In this video, let us learn about the lung volumes and lung capacities. Lung volumes represent the volume of air that goes in and out of lung, and that can be directly measured. And lung capacities mean the capacities or volume of air that can be within the lung but which cannot be measured directly, but we can theoretically calculate. So C for capacity and C for calculation. So calculated capacity or volume in the lung is known as lung capacity. Now in this graph, let us understand the different lung volumes and capacities based on that. First, we will start with the tidal volume. Over here, you can see that this graph over here, this represents the normal inspiration and normal expiration that we take in a normal rest and digest mode. This is known as the tidal volume or TV. So why it is known as tidal? Those who live near to a sea or a river, you will see that at some point of time in the day, the water level is highest, and in another point of time in the day, the water level is lowest. So the water levels in any water body rise and go down in a cyclical manner. Similarly, the air entering into the lung in inspiration and going out in expiration also follow a variation or fluctuation. And that is why it is known as a tidal volume. So tidal volume is approximately 0.5 liters in adult human. Now, mostly we take the tidal volume in and expire that out. Now, in our lung, there is some amount of air that is always present. You cannot expire that air out, because as the lungs is also attached to the chest wall, if we expire out all the air, the lung volume should become zero and the lung should completely collapse. The chest wall doesn't allow the lung to collapse completely, because the chest wall is made up of ribs and bones, right? It cannot go down to a zero volume, and hence some amount of air is always trapped within the lung, and that is known as the residual volume. So some amount of air is always present within the lung, and that is known as residual volume. Residual volume is approximately about 1.2 liters in an adult male. Suppose this is the point of your normal tidal inspiration. After normal inspiration, the amount of air that you can inspire more with all your efforts is known as inspiratory reserve volume, right? That means this amount of air can be inspired volume, but it is kept in reserve, not always used, but can be used in stressful situations where you're exercising or you are in an emotional stress, like that. Similarly, after a complete expiration, in tidal expiration or normal expiration, the amount of air that you can expire out more with effort, that is known as expiratory reserve volume. The expiratory reserve volume is approximately around 1 liter to 1.1 liter in adult, and inspiratory reserve volume is approximately 3.3 liters in an adult. Now these are the different types of volumes that we have to keep in mind. So now let us revise all the lung volumes quickly. First, we have the residual volume. That means the amount of air which is always trapped within the lungs. And why that is so? Because lung cannot collapse down to zero volume, because it is attached to the chest wall, which cannot collapse down to zero. And that is known as the residual volume, RV. After that, we have the normal inspiration and expiration, the normal amount of air which goes in and out of lung in normal respiration. That is known as the tidal volume. After that, we have, after tidal volume on normal inspiration, the more amount of air that can you inspire in with effort, that is known as inspiratory reserve volume. Reserve because it is not used regularly but can be used at the time of need. Similarly, after a tidal expiration, the amount of air that we can expire more with forceful efforts, that is known as expiratory reserve volume. These four are the lung volumes that we have to learn. After that, based on these lung volumes, we have certain capacities. Like if we take into the details that from inspiratory reserve volume to the below of RV, that is the entire limit of the lung function. Like beyond that, no more air can go in or go out of lung. That means if we take out a lung from a healthy individual and squeeze out all the amount of air, then we can also squeeze out the residual volume also. That means the total amount of air or total volume of air that can be within the lungs is known as the total lung capacity or TLC. That will be your reserve volume or residual volume plus tidal volume plus inspiratory reserve volume plus expiratory reserve volume, right? Now, after that, we have to talk about something known as a vital capacity. That means vital capacity is the amount of air that can be pumped out of lung after maximum possible inspiration in a living individual. That means in a living individual, you cannot get rid of the RV. or the residual volume. So vital capacity will be tidal volume, inspiratory reserve volume, and expiratory reserve volume. That means after maximum possible inspiration, if you start expiring, first your inspiratory reserve volume will go out, then your tidal volume will go out, and finally your expiratory reserve volume will also go out. And that is your vital capacity. As you can see over here, let's mark vital capacity with orange. So this is your vital capacity. Right. Now let us come to something known as inspiratory capacity, like how much air you can inspire. Like after a normal, by definition it is that after a normal expiration, we start that. For example, over here, if we take, suppose this is a normal expiration point. After a tidal expiration, the maximum air that you can inspire with all your efforts, that is known as inspiratory capacity. So inspiratory capacity is your tidal volume plus your inspiratory reserve volume. That means after a normal expiration, the maximum air that you can inhale, that is inspiratory capacity. That is a maximum capacity to inspire. Similarly, there will be something known as an expiratory capacity. So expiratory capacity will be after a tidal inspiration, the maximum amount of air that you can push out of your lung. So that will be expiratory capacity. So there will be EC, that is tidal volume, plus expiratory reserve volume. Right? Now, there has to be something known as a functional residual capacity. We know that residual volume we know, but at any point of time, we are not also expiring the expiratory reserve volume. We are just expiring the tidal volume. So in a way, in a living lung, we can say the expiratory reserve volume is also trapped within the lung. The expiratory reserve volume is also somehow trapped within the lung and doesn't go out as often as it should be. And hence, we can say there is a concept of functional residual capacity. There is a concept of functional residual capacity, which is basically your reserve or residual volume plus expiratory reserve volume. This amount of air in a normal or tidal expiration doesn't go in or out. So these are the lung volumes and these are the lung capacities that you need to know. Now your question will be, why we need to know certain lung volumes and lung capacities? The answer is of three types. First of all, as a medical student, you need to know this to pass your medical exams. But later on, when you become a junior doctor or a doctor in training, you need lung volumes to interpret a diagnostic test, which is known as spirometry. And whenever you have to treat a patient in an ICU setup, you may require something known as a mechanical ventilator. And the principles of mechanical ventilator are based on these lung volumes and lung capacities. So without knowing lung volumes and lung capacities, you cannot read a spirometry. You will not be able to operate a ventilator. Now this is in brief what we should know about lung volume and lung capacity. Out of these, a parting message that you should always remember, that is, all these lung volumes can be measured. We say volumes can be measured except the residual volume, because residual volume is that amount of air which never leaves the lung, and hence in a living lung you cannot measure RV by spirometry. For that we have specialized method like nitrous diffusion, nitrous washout, helium diffusion, etc. And hence all the capacities cannot be measured which have RV in them, like FRC, like TLC, like this. So this is in brief the idea of lung volumes and capacity.